Viewers, welcome back. I'm having a conversation with Dr. Veronica Adams Cooper, with Ms. Danielle Towns, and Dr. Melissa Davis. And our discussion is on food insecurity and how that is impacting local and global communities, specifically as it relates to the impact with health disparities. Dr. Davis, you had a question for Dr. Veronica Adams Cooper.
Yes, so I heard you mention a call for grants. So I was wondering, to open up the grocery stores. And I was wondering if you could speak a little bit more about that in terms of who would be eligible for submitting this proposal.
That's a great question, Dr. Davis. And to my knowledge, the city's Department of Community and Economic Development have been working towards this RFP for some time, and it was sent to the city's procurement office. Now, the RFP was due September 4th, and so it has expired, but in reviewing it, it was open for various grocers who have the capacity to bring an actual grocery store into South Albany. Now, the particulars of what the requirements are, I'm sure there are industry standards that those grocers would have to meet in terms of their RFP, but the RFP is still located online if one would want to go to the City of Albany's website, to the procurement office, just so they can review it. And if in the future there will be more RFPs, they could be in the process of making sure that their bid would be a viable bid.
Okay, I bring it up because, as I was stating in Chicago, one of the things we did in the South Side is we talked to some of the farmers so as you know, Chicago is very close to Indiana. And so there were Black farmers in Indiana as well. And so Dr. Rick Kittles, who was leading the population health program there, sort of created a partnership where the farmers would literally just bring in pickup trucks of fresh vegetables into the South Side every week. They had a specific location where they would just set up a informal, farmers market, often in just the, parking lots of churches, things like that. And so one of the things that, concerns me at times is sort of what are the businesses that are sort of popping up in our communities, and what are the standards, being held in terms of their accountability for food security. There are certain grocers who won't sell things on the shelf that are, quote, carcinogenic, right? So natural foods, things like that. I was just curious, as to whether or not there was an initiative to give incentive for specific types of stores, grocers, markets, if you will, that would highlight and ensure that what's on the shelf, doesn't include high fructose corn syrup, or, to some extent. I know that's sort of pie in the sky, that we would, have that sort of accountability on a commercial business, but, how can we incentivize, providers or vendors who make that their theme, to set up shop, even if only a couple of days a week, in these communities.
I don't know that it's pie in the sky. And so I think it's just a matter of being better advocates, becoming more learned about the generational impact of these decisions, and then other people making decisions for us and about us. And then holding our politicians, our state, our local, our national representatives accountable, and using that voice. We have so many pervasive ills that are impacting our ability. I'm still struck, and Ms. Towns, please weigh in on this. And so we have you here showcasing all of the different career fields that one can enter through STEM to make a difference. But then I'm also thinking, well, Wendy, if you're hungry, and then the expectation is that I've started off the morning hungry, I went to bed hungry, and then now you want me to go to school and stay focused and absorb this knowledge and information so that I can then enter into these STEM fields. So again, we go back to it's that the ripple effect, if you will. Ms. Counts, will you weigh in on that? I know you've also worked with some in trying to showcase these career paths to different nonprofit organizations that are youth-based. It's a focus that I want us to kind of center on. And then if you've witnessed that yourself, and then how do you bridge that? How do you make that connection that somehow you've got to move beyond this condition that you're in order to achieve this dream that you have?
Yeah, so I guess I'll start by saying, as much as we realize that education is a driver of opportunity, it's also a reproducer of inequality. And in that reproduction of inequality, it really speaks to some of the access and some of the equitable experiences students of color, students in rural populations, students of a specific gender may face. And to that end, STEM education is very intentional in engaging all the stakeholders of a community. So in addition to our K-12 partners at the school and district level, we have a primary focus on engaging parents and caregivers, introducing them to resources and trainings that may affect their employability and help to bring them to a different economic level. We are very intentional on harnessing the collective impact of a community to provide transformational experiences for students. So it's not just about the programming that you receive, it's more of a wraparound service. So in addition to STEM programs, we have someone at a food bank who's providing nutritional food for these students. It is working with STEM industry partners to provide mentorships and apprenticeships so that students can see not only what the future holds, but see themselves in these professionals. So it really is the cumulative effort of stakeholders within a community that seeks to, again, transform the academic experience and then eventually those outcomes of students through STEM programming.
Yeah, it really is about a holistic experience. And then understanding, all of us are educators in some form or another. A lot of us may have more direct engagement with students on a daily basis, but it is being mindful of, you know, the experiences that they come from, that they bring to the Albany State, to Cornell, wherever it is, to whatever the youth-based organization is. That I'm coming with my whole self, and that is what you have to engage. My thoughts, and I don't know why I went there. Dr. Michael Eric Dyson took Bill Cosby to task in a book some maybe 15 years ago about his criticism of communities of colors and how they engage and how they behave. But the criticism was void and absent of the systematic barriers that are in place that help to create who we are as individuals in those communities. And so everybody on this platform is, I know, very fortunate, but we are just one person away, whether they're in our families, they're a neighbor, they're a church member, who are having some very fundamental challenges, whether it be food, whether it be housing, whether it be access to education. Dr. Davis and I, in a previous conversation, and I believe this came up, where we talked about we're in the middle of this pandemic. Some days I don't even want to say it because we're just living it. But I remember reading an article about a young woman who, she had 3 children. And so when the pandemic hit, we're sending all children back home for health and safety reasons. And so we're transitioning the educational environment to your household. And so just access it online. And so her only means of communication with the world was her cell phone. And so now with this, I've got to go to work. My children are at home. And then I'm now responsible for their direct education. And so you're saying just connect to Wi-Fi. Well, this is the only device in the house.
Yeah. I mean, that's so unfortunate. I mean, one of the things too that comes to mind, you know, in the research that I do, especially like during the pandemic, right, is sort of this transition now to telehealth, you know, to limit exposures. You know, clinicians are telling patients to only, you know, log in for visits, you know, if possible, but that's only creating a larger gap in terms of clinical services. And so once again, you know, we're going to see emergence of a larger gap in health disparities because now we're so dependent upon technologies that aren't necessarily available. And so school, education, you know, my children, again, you said it, we're fortunate, right? You know, my children right now are logged on the same Wi-Fi, and I happen to be able to have accessibility to broadband that allows us to have that bandwidth. But that's not true even for some of my children's classmates, you know. You know, one of my daughter's best friends, you know, I wonder often, you know, how they're faring in this time. And I want to reach out and say, you know, let me know if we can help. But you know, as a community, we tend to be relatively proud, you know, about who we are, no matter what our shortcomings are. We're not going to ask for help. We're going to try to make do with what we have. But I think that's where education is so key early on, you know, and to tie back into what Dr. Towns was saying, you know, science communication needs to be very straightforward. I shouldn't need to have access to Google to have access to information, you know. And sometimes we are the keepers of knowledge, right? So what you learn, you share that knowledge across the board. You know, if I wasn't able to log in and see the podcast, you know, share the information in various formats, you know, newsletters, if you will, you know, any kind of I'm really an advocate now of community outreach. You know, let's just show up and talk about what it means. What is cancer? What is food security? Insecurity? What are high quality grocery stores? Like, what do you mean when you say that my grocery store isn't high quality? I mean, basic information. You know, the fact that we just talked about preservatives, that's what I mean. You know, don't eat foods with high fructose corn syrup. I'm now showing my children that they're old enough to read. Turn the package around and read the ingredients.
Very good.
Sugar, you know, we're limiting sugar, right? They know that. But if you see these words, high fructose corn syrup, do not consume it. So everything that you have, turn it around and look at the ingredients, even in your limited choices. And I understand that where you live, you have to choose. You have options. You have to choose from those options. Even within those options, can you find some options that won't be a detriment to your health, even if you have to go to the quick trip today? Like if that's your only option today, turn the thing around. Like whatever you're about to buy, ask for the ingredients, you know, and just simply ask, you know, ask yourself, read and see whether or not it has different things and different things that are detrimental to your health. And so as a science communicator, you know, Dr. Towns, in the STEM field, you know, early on, let's teach our children about what these chemicals are, you know, and why they're bad, so that even if they start having to make choices with bad options, they'll at least have information to, among these bad options, pick the thing that's the least detrimental, if you will.
Yeah.
I'm sorry, I don't know the full answer, but you know, it's going to take a multidisciplinary, you know, effort to really, you know, make an impact.
Yeah, and that's exactly it. You know, in addition to providing the STEM education programming, we're very cognizant that you can't introduce apps to an old operating system, right? And so with that, in addition to just, again, how we engage young people, we're also very intentional about how we engage their caregivers. So through trainings about nutritional value and food insecurity, or what is a food desert? And if I'm in a food desert, how do I select from the healthiest options?
Excellent.
We're very intentional on introducing concepts of culturally responsive education, right? And so knowing some of the limitations that we face in our community between economic segregation, some of the exposure to mass incarceration and drug addiction, how do we train up and rise above that, given what can be perceived as very limiting circumstances? So that's why, you know, the approach to the 21st century skills, representation, you know, exposure to larger community stakeholders becomes so very important.
I agree. That's a great point that you make. And I'm so, that's why I'm so thankful for a Channel 19 or HBCUs or any platform that allows the showcasing of you ladies, because representation is absolutely so critical. It could be one person, it could be multiple Adams Coopers, but it could be just that one engagement with her that can make a huge difference and change the trajectory of someone's life, because then it becomes tangible to me. And I'm that then when you fail to provide that, not only to that child who may not necessarily have direct contact, but to the greater populace, the majority, if you will, who then make decisions and see, because what the point that I'm trying to make is, you ladies are not an anomaly. And that is what the greater society will try to project, that you're the exception, that there's only a few Adams Coopers. And in my world, I'm very fortunate to know quite a few. But I think, as you said, those that are in those locations or those communities that may not have direct access, may not know that it's possible to be a Danielle Towns or to be Dr. Melissa Davis or Veronica Adams Cooper. And so these platforms are critically important, and we have to be intentional. And as it was said earlier, just make a very conscious decision that we are going to be responsible for ourselves and not rely on someone else to do it for us. And then be able to provide those basics. Back to the origins of this conversation, food. Yeah, just those basics make all of the difference in the world.
So one of the things that I really liked about when President Obama was president and Michelle Obama was, our first lady, I really loved sort of the things I started seeing in like the public health, in the public school system, right? Like all the sugary drinks disappeared all of a sudden out of all of the, vending machines. And you would go into McDonald's or your fast food place and you would see like the nutritional menu up. So, and these were like mandates because of, policies that were initiated under that administration that have now been wiped away. And so now the sodas are back, and I have to, download the app to see what the nutritional value of the food is in the restaurants that I'm in. I want to see some of that come back, sort of voluntarily, or maybe it's something even from, from an HBCU perspective. One of the reasons I'm here right now is because I really feel like, especially in a community like Albany State should be the gatekeeper of the knowledge that our community has to this information. And so, I'm here for that. I want to, somehow project this information into the community in some form. Maybe it's a commercial,
right?
Maybe it's just, signage that's, around the city that, basically speaks to some of these opportunities that Dr. Adams Cooper was talking about, some of the community outreach that Dr. Towns is talking about, so that it's not a surprise, like it should be common knowledge that these initiatives are underway, and some of these basic science, messaging that you're sending, through the people in your program, plaster it everywhere. Like we need to share our knowledge. I think that, historically Black colleges transformed the ability of people who are the descendants of slaves to be able to have an education and gain this knowledge. And we still have that responsibility in our communities.
I agree. And it could be as simple, and we are working on that. We're having conversations with you ladies. We're having conversations with an organization that is helping to support our food beds and our greenhouses on campus, and just enlightening students and working to empower them. You do have a responsibility. You exist in this world. There is work that you must do. You cannot succumb to it.
Absolutely.
Although, some days it's like, but you have to keep pressing forward. That's what our ancestors certainly did. And we have to carry on. We'll have to have you ladies come back. But before we wrap up, I just want to kind of go around, weigh in terms of, let's give some hope to our viewers, particularly those young people who may not have that immediate representation on, again, I'm just trying to eat and you want me to do this, and this. Let's give them some hope. I'll start with you, Ms. Towns. Give them some guidance and directions that this is achievable, this is possible through the STEM field.
Yeah, again, STEM is just a great lever to unlock students' potential. And as we think about how it relates to food insecurities and health disparities, the more that you can engage in STEM, the more that we hope to inspire you to pursue that STEM career, post-secondary education. That becomes your access point to higher income, which allows you the freedom to, again, be in safer communities, afford to put more food on the table. But as a student right now, there are so many opportunities, so many programs that you can engage within. So Boys and Girls Clubs of America, specifically Boys and Girls of Albany, has a fantastic STEM program. They have activities where students are planting pumpkins, 4th of July weekend, so they're ready for harvest by Halloween. But in addition to that really fun activity, there's a lot of providing of resources and providing of nutrition. They can connect you to your food bank. They can connect you to grocers who may have discounted programs for you. There are programs at NASA that really aim to engage starting at 4th grade, that takes you through an experience through high school where you have access to internships and year-round programming. So although, it may not be as immediate of an output for students in the pre-K through 12 space, just knowing that STEM education is the entry point that can, again, alter that trajectory for, improved access to, safe spaces that will not leave you locked in a food desert and ultimately improve those health outcomes.
Outstanding. Thank you. Dr. Adams-Cooper, you're a public policy expert, do great things in our MPA program here at Albany State University. Can you translate that over to our topic of discussion as you close your particular area or contributions in this conversation, how that then can impact food insecurity and then the direct tie to health disparities and improvements?
Certainly. I would like to share that there is a policy that many people really still don't know about, and it's Public Law 115-102. It was enacted by President Trump, and it is the 400 Years of African American History Commission Act. Buried deep within that policy, there is one clause that I call the impact clause. And it is that the United States would acknowledge the impact that slavery and laws that enforced segregation that it had on the United States. That one little clause is, I believe, the key to helping all of our communities of color and of majority understand when one part of the family is hurting, we are all hurting. And our nation has a 400-year history that must be healed. And from that trauma healing, we can begin to answer and restore in earnest many of these disparities, from housing to education, to food, to health, to our penal system. They all work together once again. And so at the very basic level, food is fundamental. When we look at the history of the African American experience, we were the laborers to bring food and other industry. And so until that understanding is fully embedded in our education system and throughout all of our industries, we don't move forward. So it will be the village. It will be the village. It will be our churches. It will be our sororities and our fraternities and our other civic organizations within the what is called the civil society, working along with government, working along with private industries to come up with viable solutions. And so, yes, when we went into the grocery stores, to the convenience stores, there are some alternatives that can be solved or can be purchased. You have salad items, there are fruit items, there are fruit juices versus sodas, there's water, there's skim milk versus whole milk. So there are options even if you are in a food desert. And then when you go to the regular grocery store, go in the perimeters. And so it's a change of behavior.
That's right.
That change in behavior and mindset does not happen over time. And when you have all kind of commercial ads making you want McDonald's and potato chips and all of the bad things, you have to really have a plan at a family level that says we want to be healthier. And so we will continue with the efforts of the Center for Engagement here on campus, with Dr. Lindsay in Student Affairs, and also with the various organizations in the community. And you mentioned Farmer Fernando, with our community gardens here on the campus of Albany State and within the community. We just need a vehicle to integrate and to collaborate so that the impact and the synergy is much broader than just a few areas being impacted. So there is hope. There is hope.
Thank you, Dr. Adams Cooper, for reminding us that there's hope and then giving us a detailed outline as to how we can approach that. Dr. Davis,
Yes.
wrap us up from your frame of reference and your expertise. We're talking about the health disparities. Dr. Adams Cooper kind of gave us a charge in terms of making decisions, regardless as to what our conditions and our circumstances are, with those healthy choices, regardless if it's a convenience store or a huge grocer, staying on the perimeter, being conscious as it relates to public policy. We'll have to do some research on that clause, because you're absolutely right. The vestiges of the institution of slavery itself, it permeates every aspect of our life, and we're still riddled with that. And so we have to be conscious of that and then make those decisions. But Dr. Davis,
Yes.
from the health side of the house, if you will, give us some hope. We're going to make those, when we make those healthy decisions, how does that affect us physically, and
Right.
hopefully increasing our longevity, opportunities for longevity?
Well, I'm a geneticist, so I'm going to bring it back home to my work. Like Dr. Adams Cooper, pointed out that, the fact that we are descendants of enslaved Africans also speaks to our genetics. And that's one of the things that we focus on in my lab. We look at the differences between, the cancer subtypes and prostate cancer and breast cancer across the diaspora. So I have a global oncology program. And so when we look at patients in Africa and the gene networks, if you will, and how they are regulated in tumor progression, why tumors are more aggressive and less responsive to the treatments that are available, more aggressive in the African American community, more aggressive in West Africa compared to East Africa. We know that to some extent, it is an underlying response to the environment. Okay, so it's not about being inferior. Our genetics do not make us inferior. Our environment assaults us, right? And so to what extent some of that is modifiable? In the sense that, systemic racism creates a stress response. Some of it has even been shown to be transgenerational in terms of, the African diaspora and sort of the implications of what it means to be stripped away from your heritage, stripped away from your identity. And we can see that imprinted across genes. What I can also tell you is that in the data that we have, we also know that obesity, diabetes feeds into these pathways that makes tumors less responsive to treatment, makes cancer more aggressive. It even makes cancer show up earlier in life. One of the themes that we see all across the board with every type of cancer in the African American community is that we get it sooner and we get the worst type of it. And she's right, food is fundamental. What we eat consistently every day impacts the way that our genes interact with each other. And so that can impact not only your susceptibility to malignancy, but how your disease course progresses. And so what you eat during treatment is very important. The team that's trying to cure you of your cancer isn't necessarily going to tell you how you should eat, but there are people who can. We need to be more invested in, like she said, food securities and making choices even when you have, you know, an overwhelming, you know, bad options, you know, in front of you, to make the best choice that you can. I would say that the gene interactions in the people of West African ancestry are very sensitive to the types of foods that we eat. But the hope that I would leave you with is, to what extent you can find even just one healthy option a day can impact those networks enough that you could have a better outcome. And I'll give you a prime example. One of the things I used to teach in my medical class is, we know, for instance, you know, when we eat red meats and we like to have it grilled, and, you know, that really salty, crunchy part of the steak, you know, that we really like, you know, that the grill marks, that black part of the meat actually has mutagens in it. And, you know, you ingest those things and your cells become mutated, because literally there's a chemical that your body, when it metabolizes it, it can damage your DNA. But if alongside that juicy grilled steak, you have some Brussels sprouts or some collard greens that aren't overcooked, those plants also have a chemical that, when your body metabolizes it, can neutralize those mutagens. So even if you have all these bad choices, if you make one good one in that meal, it can neutralize some of the bad choices that we have to make. So that's what I would leave people with. And then coming back to the STEM part of things, I need to get that message out, you know, in a simplistic way. You know, instead of talking about mutagens, you know, just talk about, these are the options that you need to choose from. Check a box in one of these, you know, food groups once a day. You know, even if every meal you have can't be full of fresh vegetables, if you just have one a day, you know, check this box once a day. So my hope is that the research that we do will translate to not only educating the community about why making better choices is important, but also eventually maybe some of the discoveries that we make gives us the ability to make sure that the treatments available are actually better. And so when you come to the clinic, we'll have something that works better.
Outstanding. Now I'm ready for a part 3 and a part 4. I was just thinking, I had a conversation yesterday, and it was a panel discussion with the president and a local counselor, mental health counselor here in the area, and we're collaborating on a couple different projects. And so, because it really is a confluence, a marriage of so many different things, and we were talking about mental health and what that diet consists of. And so it really compounds. So if you're ingesting, I was giving an example, I had to log off for a brief moment last week on a Zoom call because one of our great students on the call just was a mirror image of Breonna Taylor. And I had to log off because I was still processing what we learned in the media a couple days prior about how she laid there for 20 minutes and no one even bothered to see if she had a pulse or if they could resuscitate or whatever. So I'm still processing that. So my point is, are those external variables that impact us. So what winds up happening, maybe it's just me. So when you're doing that, then you delve over into or transition over into that emotional eating. And so somebody mentioned some chips earlier. That's my weakness. Yeah. So I'm going to, because I need to try to escape that. But sometimes the escaping of reality is far worse than reality, if you will. So depending upon the community, I may not have access to a track or a piece of fruit as opposed to a readily piece of fruit as opposed to, the bag of chips. So again, I could go on, but to bring this to a close, what I've heard all of you all say is that you have to be intentional. You cannot rely on someone else to do it. And those that do have positions of authority in terms of moving the community forward, you then have to hold them accountable. And we have to be intentional with putting representation before our babies, before our students. And we have to be wise enough to have access to a level of information so that we can have intelligent conversations if we do find ourselves, you know, before a Dr. Davis with trying to help us to move past whatever the diagnosis or prognosis is in our lives. So intentionality is going to be critical. So ladies, I've learned a lot. Thank you so much. And I know our viewers have. I'd be remiss if I did not say thank you for your intentional involvement. You all live these lives up close and personal. You're responsible for educating individuals and then trying to, as we are ending this out, with providing them with some level of hope, you know, straddled with all of these challenges. But what you have said is it is doable. Our ancestors did it. It's just a matter of asking, and those that are armed with knowledge or access, you being more involved. And I'm speaking to everyone. So that's within viewing and the listenership out there. But thank you so much for this conversation. Well, we'll have to do it again. We'll just have to put it on our calendars to see what strides we have made. Dr. Adams Cooper mentioned the work within the community. And so what are the next steps 6 months, a year from now? Ms. Towns, your work in terms of educating our young people and then bridging that gap that although you may be suffering in terms of lack of access as it relates to the fundamentals of food, there is still hope for you out there, and here are the ways in which we can navigate that. And then Dr. Davis, your work globally is greatly appreciated, and we look forward to hearing what you are continuing to do in terms of your education and then just healing people.
Absolutely.
Okay. Ladies, thank you so much for joining today. It was certainly my pleasure, and I look forward to having you back on the show.
Thank you.
Thank you.
It's so wonderful to meet you all.
Well.
Viewers, thank you so much for joining me for this special edition of Realizing Potential. I'm Wendy Wilson, and I look forward to seeing you next time.